Coronavirus vaccines will not be going out to as many pharmacies. The state health department says it will be sending doses to pharmacies that it says have been more efficient at getting shots into arms. And that decision not sitting well with some Pennsylvanians. Westmoreland County Bureau Chief Ross Guidotti talked with some of those people. He joins us live right now with their reaction. Ross.
Hi, Kim. The state says in the long run, this plan is going to get more shots into more arms quicker. But I spoke to a small town pharmacist who told us the plan as it stands essentially treats the people that she serves like second-class citizens. It was a busy day at Roadway Pharmacy in the small Westmoreland County town of Seward.
Be careful of my chicken.
Okay.
The store lined with chairs. Pharmacist Brittany Miller administered doses of COVID-19 vaccine one day after the State Department of Health told her and hundreds of other small pharmacies they won't be seeing any more doses anytime soon.
We get this email and now we're getting cut off because we didn't do enough.
More than 1,000 locations had been getting the vaccine. That number is now to just over 300.
Just told me that we weren't important enough in this small rural area to get the vaccine.
The state telling those crossed off the list. In the near term, we are asking that you stand by as we temporarily focus allocations on other providers amid limited supply. You should not expect the first doses or receive additional first doses over the next several weeks. We look forward to the day we can distribute the vaccine to all of our providers. Harrisburg says the 300 still on the list have simply done a better job at getting people vaccinated.
Essentially, they put us on like a report card, They were like, well, you just didn't do enough. Well, they didn't give us any. How can we not do enough if you're not giving us the vaccine to do it?
I think it's ridiculous.
Alice White got her first shot, White telling me some seniors and those vulnerable living in rural areas may not have access to pharmacies deemed worthy for more vaccines.
It is counterintuitive, and it's another thing. You're putting these people at risk.
You're restricting the vaccine to a handful of pharmacies or whatnot and not giving to the small ones that are actually involved in the community.
Tom Wenkoop is a nurse and has helped administer COVID-19 vaccines at Roadway, says, while well-intentioned, the state plan is the epitome of inequity.
Oh, there's hundreds of people here that need that vaccine, and they want it, and they need it. You give it to everybody or you don't give it out at all.
All right, Brittany Miller tells me the state has told her, and presumably all these other pharmacies cut off the list, that they're going to get the second doses within that 42-day window for all the people who got the initial first dose. Remember, they're not going to get any more first doses. Brittany told me, however, she will believe that when she sees it. In Greensburg, Ross Guidotti, KDKA News.